Hey folks, this is Cesar Perez. Today I'm going to talk about 3 tips if you're uninsured on how to cut your healthcare expenses. And so I'm going to get right down to it. Our number 1 tip is use an urgent care. Now, before you're going to go to the urgent care, it's very important that you do your research because there's going to be different urgent cares in your location. I'll give you an example. Here where I live, we have around 5 urgent cares that are about 5 miles away from here. And if you go to each of them, they all offer different services. There is an urgent care about 1.5 miles from where I live, and they actually offer, the doctor there has an x-ray machine, he has an ultrasound machine, he's able to perform surgeries. So it's pretty much an all-in urgent care. So before you're going to use any type of services, you want to do some research. Go and visit a few of the urgent cares and make sure that the facility, make sure you know what services they all offer, because they're not all going to be the same. So I'll give you an example of how an urgent care is going to save you money. So for example, that urgent care I'm talking to you about, for a cash paying patient, if you don't have insurance, is going to cost $120. Now, it is pricey, but at the same time, if I break an arm and I don't have insurance, or maybe I fracture it and I don't know, instead of me going to the emergency room, I can go to the urgent care, and because he has an x-ray machine there, he's going to be able to take an x-ray, and it's going to be included in the price. So I'm not going to have to go elsewhere into a different facility and and get an x-ray and then pay more out of my pocket. He's pretty much going to take care of all of that there, and anything they do is usually all inclusive of your price. Now, when you pay cash as opposed to use any type of insurance, you do have an advantage because number one, doctors don't have to do paperwork or a lot of paperwork when it comes to prescribing medications, doing a certain type of procedure. They don't have to get any type of prior authorization. When you are on Medicaid, when you're on Medicare, or when you're on any type of insurance, they do have a lot of behind the scenes work that they have to do, and so that sometimes causes delays. However, to you, if you're paying cash, you're going to get the services, whatever they can do there at the office, at the facility, you're going to get it at that price. Usually, again, like I said, there's not going to be any other charges. So go to the urgent care. That's what you want to do. The urgent care that we have here also, after your first visit, if you need to go back again, they only charge like $65 after the first visit, which is pretty good. So the first visit is going to be more expensive, but then if you have to come back again, it's going to be a lower cost. So that's tip number 1. Tip number 2: if you don't have a health insurance, you want to download an app for your medications, because chances are, if you're going to go to the urgent care, or maybe you have a primary care doctor that you can go to, that's not very expensive and that can see you in that same day or the next day or whatever the case might be. If he prescribes medications, you're going to have to pay out of pocket for your medications. So you're going to want to download an app. If you go on either the Apple Store or the Google Store, the Play Store, you're going to download the GoodRx app. And so the GoodRx app, what that's going to do is it's going to cut your medication costs by anywhere from 20 to 80%, which is a huge savings. I have no idea how they do it, but it works. I have had people use the app. I've used the app myself just to see if it works, and it absolutely works. You can use it at any pharmacy that comes up on the list. So when you use the GoodRx app, you're going to plug in the name of the medication. Once you plug in the name of the medication, you're going to hit find the lowest cost on there, and it's going to show a list of all the pharmacies that are near your zip code, and it's going to show the major ones like Ralph's, Costco, Walmart, Walgreens, Rite Aid, any of those, and it's going to show you the lowest cost there. and it's gonna give you a coupon to get that price. The reason I like using there's also GoodRx cards that you can find like at different doctor's offices, but I don't like to use those because if you use the GoodRx app, when you go on the application and it shows you the coupon, it tells you how much you're supposed to pay for that medication. When you use a card, it doesn't give you that. You're at the mercy of whoever's in the counter, and if they say, "Oh, it's $20," well, that's how much you got to pay. But if on there you see that it's only $5 or $7 or whatever the case might be, then you're gonna save a lot more money. It's a lot more transparent that way. So that's tip number 2. And then finally, for tip number 3, if you gotta do some lab work, I want you to use your local labs. So what do I mean by that? Well, you don't want to go to Quest Diagnostics or LabCorp. Those are the biggest companies in the US, and chances are there's one in your area. However, because they're such a large company, they don't really offer you, or you can't really negotiate with them. So you definitely want to find a local lab. A local lab is just, a lab that's smaller than Quest or LabCorp, and you're gonna go in there and ask them, hey, what prices can I get? What cash prices can I get if I'm gonna do my lab work here? And they'll typically have a list, or they'll tell you, well, for this test we're gonna charge you 50, 60, 100, or whatever the case might be, and that's what you're gonna pay. And you're not gonna get another bill or anything like that. The other thing you can do is you ask your doctor at the urgent care. If you go there, they might have connections with a few of the labs, even the local labs. They might have a connection. They'll tell you, well, if you're gonna have lab work, you try going to XYZ lab, and they're gonna give you this price. And sometimes they'll negotiate with the doctors directly, and the doctor can give you a certain price for the lab because they have exclusive contracts with the local labs, or sometimes they even have them with the national chains. But that's what you want to do. This is going to save you so much money by using these 3 items. One last thing that I didn't mention under the urgent care, there's also clinics that are volunteer clinics, and so typically the volunteer clinics will give you the services at low or no cost. So if you have a volunteer clinic, for example, here where I live, we have a volunteer clinic, and they cater to the uninsured population and to people that that for whatever reason have a certain condition, like maybe they develop diabetes and they just don't have insurance. But that particular clinic will treat anybody pretty much, but they like to treat people that are underinsured or not insured. And so pretty much those are the 3 tips. I hope that was helpful for you. Thanks for watching.